This is a urine sample collected from an old dog. It appears black because blood is present, and this signifies that there is a problem within the urinary tract and it requires prompt treatment. An 8-year-old male Maltese cross was brought to a vet for having blood in the urine. According to the owner, it happened quite recently, just a day before it was brought to the clinic. It had been feeding on dry food and insufficient intake of water. This could lead to the formation of urinary stones, which contribute to blood in the urine. Another possibility is that it may be suffering from urinary tract infection. The vet did a normal routine check, such as recording the weight of the dog, taking temperature, and checking pulse rate. Since the dog has urinary problems, it was obvious that the urinary tract had to be checked as well. The vet palpated the abdominal area to check for signs of pain or any abnormalities within the bladder. In order to diagnose the problem, 3 tests were done on the dog: blood test, urine test, and X-ray. Blood and urine samples will be taken to the lab for analysis. Performing a blood test can help to determine the overall health of the dog by checking various components such as the levels of hormones, enzymes, metabolic waste products, and many more. This in turn shows whether the organs are fully functioning. For example, blood in the urine can be due to kidney problems. Urine sample was collected to analyze the blood present and levels of salt components that contribute to the formation of urinary stones. The first attempt failed as there was no urine at all. What the vet did was to hydrate the dog with IV fluid and therefore producing urine. After 10 minutes, urine sample was collected. The final test was to perform an X-ray on the dog to check for urinary stones within the urinary tract, such as the urethra, the bladder. The dog had to be hospitalized to monitor its condition before it deteriorates and worsens. It was given IV drip to keep the dog hydrated, antibiotics for bacterial infection, and pain relief to reduce the pain, as urinating can be quite painful. According to the blood test result, everything was normal. This implies that the blood system and the organs are functioning normally. As for the urine sample, it had high levels of white blood cells and red blood cells. This implies that there is infection within the urinary tract. However, due to its high turbidity, biochemical tests cannot be done, therefore unable to measure the levels of salt components. The X-ray film showed that there were no stones inside the urethra and the bladder, although the bladder was unclear. Based on the results, the dog was diagnosed with urinary tract infection. Fortunately, the infection was localized and did not spread further up the urinary tract due to early treatment. Therefore, early treatment is important as it can prevent infection from spreading and worsening, which can create severe problems for the animal.